Dawn and her team of emergency service volunteers arrive at the scene of a head-on collision on the remote stretch of a Nevada highway. They are hours from the nearest hospital.
In our line of work, you have what's called the golden hour.
That's the amount of time that you have the highest likelihood of survival.
I'll take the two most serious patients.
I'll
4
take
patients total.
If you were in a city, you'd probably be to a hospital within a couple minutes, where we are looking at hours to get to a hospital.
Transport from US 95, Esmeralda 34.
In big cities like New York, ambulance response times are measured in seconds, because of course, in emergencies, seconds matter. But outside of cities, the equation is different. In recent years, rural hospitals have been closing at a staggering rate, creating so-called medical deserts where millions of Americans live hours away from healthcare. Tonopah, Nevada lost its hospital in 2015, which has people in town asking, what are you supposed to do if you're hurt and doctors are hours away?
When we first heard the hospital was going to close, it was kind of like, everyone's going to die. I mean, that's kind of was our first initial panic, like, are you kidding me? We have to have a hospital.
We've actually picked up patients from the front steps of the old hospital facility. They went there expecting to get treated, and the lights weren't on.
When Tonopah's hospital closed, it was very sad for everybody around us. They serviced all of Esmeralda County and most of Nye County, Mineral County. We're talking hundreds of miles. Tonopah is a very small community. We have about 2,500 people here. Most people work in government, mining, or solar. We live very far from any Walmart or a dentist office. You know, we're out kind of in the middle of nowhere.
A desert rat. We're called desert rats. The Nevada countryside is absolutely beautiful.
Just the mountains around me and the size of this valley. It's like, I'm just a speck in time. All my troubles from the day, they're minuscule.
It's not like living in a city where you don't know anybody. You feel very safe here because you know that everybody else has your back.
Today, Tonopah's ambulance service relies mostly on unpaid volunteers.
Christmas, Thanksgiving, if the pager goes off, that holiday is ended. It's something that we're really proud of, and it's nice to be able to give back to our community. But it is a high-stress job, and I have thought about quitting before. I'd be lying if I said no.
Before the hospital closure, it might take 30 minutes, but after the hospital closed, we have to ground transport them to either Hawthorne or Bishop.
We have to assume it's going to take up to 5 hours. Balancing everything is quite the juggling act. I work in the Nye County Recorder's office. I'm the Chief Deputy Recorder. In addition to working here 40 hours a week, I do have children, Taylor, Trent, and Tracy. They're 4, 11, and 14. Kids are a lot. Sometimes you work a 10-hour shift at work and then you run a call at night. It's a long day, and that wears on you.
Best thing to do is anchor go inside, then run it on. Okay, yeah, we got 4 victims.
It's heartbreaking when I hear of stories where people die because we don't have a hospital. I wish I could say there was an easy fix for this, but there really isn't.
The problem that we have here, it's not unique to Tonopah. There's lots of areas in the United States that don't have hospitals.
Since 2010, over 100 rural hospitals have closed their doors. And according to some estimates, 1 in 5 are at extreme risk of closing soon. The causes are complex and layered, but one is that young people are moving away from rural areas, leaving older residents that are less likely to have private insurance, or any insurance at all. Also, as small towns get smaller, even volunteer services are shutting down. And the fact is, states are not mandated or obliged to provide health care to rural areas.
I think the future of the communities depend on having some basic medical services throughout the nation.
Towns everywhere are getting scrappy, finding ways to adapt and fill the holes. Lorinda was able to pool resources with neighboring districts, raising $800,000 in taxes to hire a few professional EMTs. The town also started a telemedicine clinic where patients can video conference with doctors in Reno and Las Vegas.
But still, it doesn't help in the situation of an emergency.
Back to that collision from the start of the story. Despite the best efforts of EMTs, 3 members of the community died that day, hours from a hospital.
Pretty much all of the volunteers definitely knew everybody on scene. It makes it a lot harder because then you still have to see these people in public and know what happened. It makes it a lot harder emotionally to even see them, because then every time you see them, it's a reminder of what happened, and I'm sure that's the same reminder back for them.
What is that thing that drives you to keep going?
Because people need help. When you start to feel down about it or start to feel like you're kind of losing your way, you'll be on a call and you know that they wouldn't have survived if you wouldn't have been there. But it would take off so much weight from the EMS system if we had somewhere that we could transport to. We need an emergency room.